Good afternoon. Thank you for tuning in to our live briefing for Monday, April 6th. We have a lot to share with you today. I'll have my information first, then you'll hear from Russell Gardner. You'll get some updates from Deborah Jacobson, and then we will all get some much-needed stress reduction from Taryn Young. And today we'll finish with a poem and a prayer from Lynn Mcclintock. Let me start out first by just telling you what we know about what's going on in our region. According to the Virginia Department of Health, in the Commonwealth, there are, this I think is yesterday's data, maybe it's this morning's, I'm not sure. We have 2,878 active cases with 497 people in the hospital, and we've had 54 deaths. This morning I spoke to Dr. Danny Avula on the phone for a good while, and he shared with me there are 8 senior living communities in our area that have a cluster of active cases. We also learned this afternoon, really right before we walked into this, that a member of our evening housekeeping staff has tested positive. The employee has been in quarantine for nearly 2 weeks due to the fact that her husband came down with an illness and was tested and had tested positive. The source of his infection appears to have been from a church retreat that he attended earlier in March. Thankfully, due to the staff member's evening schedule, she really had no direct resident interaction, and even her staff-to-staff interaction was limited. We are currently, as we speak, actively tracing amongst our staff to determine who may have been exposed, and we'll get that straightened out here shortly this afternoon. Along the good news line, our staff member continues to be at home on quarantine and has had no symptoms. And so we're very thankful for that she's well and it has been home for nearly 2 weeks. So that's good. And as far as we can tell, there's no relationship between our employee and our resident who we told you about on Friday. They would have had no interaction that we know of. Both the resident and the staff member feel they never interacted, so that's good. And we continue to try to determine the source for our resident who's currently in the hospital. Changing gears a little bit, we've gotten an enormous amount of employee support from you, the residents, and we are very grateful for all your thank you notes, the calls, the encouragement, the comments in the hall when we see you. Very, very appreciated by everyone. There are many ways that you can help our employees during this time, and some of you've done that. We've seen a number of gifts made to the Employee Christmas Fund, and we've also had a number of people give gifts to the Westminster Canterbury Foundation on behalf of the residents. A couple of them, we share the notes. We got a note the other day that said, in honor of, in capital, the entire WC Richmond team, top to bottom, you are, capitals, the best. We are so blessed. Thank you for going beyond. Another one just said, in honor of our bold, superb staff. We're very grateful for those comments. There are literally hundreds and hundreds of notes and comments or emails and comments that have really lifted everyone's spirits, and for that we're very grateful. Now, in addition to the Employee Christmas Fund, you can also support employees, if you choose to, with gifts to the Foundation's WEAVE program. The WEAVE program stands for Workforce Education, Assistance, Volunteerism, and Engagement. When employees face challenges, financial emergencies, they can ask for assistance through that program, and then your tax-deductible gift can help when employees need it. On behalf of all of us, we really just want to thank you again for all you're doing, and thank you for your thank yous to the staff. It's greatly appreciated. The next thing I want to talk to you about is masks. I have mine in my pocket. As you probably know now, employees are wearing masks around campus. Most are wearing the cloth masks, and we're wearing those to protect you from us, because our assumption is we're all we've all been exposed. There's really no way to know who's been exposed and who hasn't. And as we know, folks are asymptomatic and shedding the virus. So we will be wearing these to protect you from us. And at this time, we don't yet have enough fabric masks for all of our staff, but we're working on that. We're having some made and we're getting some donations, which we think in the next day or two, we should have an adequate supply to supply all of our staff. We want and need to protect our medical grade masks, the surgical masks and the N95s for our clinical staff in case they need them when we do have active cases, or if somewhere else has a need, someday we may have to help them. Many of you, the residents, have asked if we'll be supplying masks to you. At this point, we don't have an adequate supply to do that, and so we're not offering masks to residents. If we stay masked and you stay away from us, you shouldn't need them, and they're really not a good substitute for social distancing. And here on campus, you shouldn't get exposed if we stay away from you. We are beginning to take donations of cloth masks that are made per the CDC's guidelines. And we'll share those guidelines in today's written summary, and those will be on our blog and on the Touchdown Community app. If your family members or friends out there in the broader community want to donate homemade masks, they can drop those off at the gatehouse, and then we will have them disinfected before we distribute them to staff. We have some UV light machines which disinfect these masks before anybody wears them. If you're interested in making masks or you want more information, please reach out to Sarah Abernathy at extension 6268, and she's there to help you if you want to make masks. We have some supplies, we'll be getting more supplies and putting kits together for those that want to make them. Your help is greatly appreciated. We hope to have enough that we can offer one to residents if they want them. I will tell you they're not comfortable, and so if staying away from people is far more comfortable than wearing a mask. So if you can social distance, that's a better option. The last thing I want to talk to you about is some information we need to share about some business decisions that we must take. These are really intended to protect Westminster Canterbury and our financial position if this condition, the pandemic situation, were to persist for the long term. In the short term, the situation is having a significant impact on our costs and on our revenues. So we have to take some hard but very prudent business decisions. We've asked all of you to make sacrifices, and so we've asked our staff to make a sacrifice along the same lines in terms of some of their worked hours. Our intention is that this is short-term, but with the duration of the COVID-19 situation so uncertain, its duration will determine how long we need to do this, but we'll be taking a month-by-month look at this situation. We've shared this information on Friday with both our corporate board and our foundation board, and I intended to share this with you at our Friday briefing, but unfortunately, the news of the second positive case caused me to hold this news back for today. I'm going to ask Russell Gardner to come up and share more of the details. Russell?
Good afternoon. Most of you are aware of the good work of our management team and associates, particularly their responsiveness to disruption with services and disruption to our supply chain. As John mentioned, in an effort to mitigate the financial impact and hopefully avoid more severe changes in the future, if this COVID-19 situation continues to persist or worsen, Westminster Canterbury's management team has taken immediate action to reduce our expenses. Due to the stay-at-home, self-quarantine, and social distancing rules, most of our resident services and programs have been dramatically reduced or suspended, allowing us to reduce our labor requirements. It is important to note that these changes do not apply to our clinical staff and have determined, or any staff member who is determined to be essential to ongoing operations. We updated our coronavirus leave policy and are instituting the following beginning today. Employees may self-select to take time off without pay for up to 4 weeks. We are adjusting hours for non-essential staff, defined as those who are not in clinical positions and those not actively in COVID-19 related processes. Non-essential full-time employees will work a reduced schedule of 32 hours per week. Part-time employees will work a reduced schedule of no more than 20 hours per week. This has been a very difficult decision, but we feel is the right one given all the changes to our operations. We do not anticipate any major service disconnects related to these changes. These changes assist the organization with mitigating weekly lost revenues of approximately $75,000. As John also mentioned, we will reevaluate this new policy around the first of the month, sometime around May 1. All employees have been notified. Our teams are planning for the adjustments in the coming weeks and days. We appreciate the hard work and dedication everyone has shown over the past few weeks. And on another note, as you're aware, we've created some new processes and a few workarounds related to our business systems. We appreciate your understanding that they're not all perfect. Our teams are doing a great job with continuously responding to the daily changes. Residents can help us keep extra costs down by complying with guidance and instructions from the health department, our medical team, and Westminster Canterbury's administration. Deborah Jacobson is up next to provide some more updates.
Good afternoon. With quite a few types of information being shared with you today, I'm going to cut mine a little short and come back and answer some more questions later in the week. First of all, here's my mask right here. Just taking it off for a few minutes. Hand washing. Later today, you will receive a notice about hand washing, something that you can place on your fridge. The notice reminds you when, how long, and with what to do your hand washing. This comes to you as a recommendation from a fellow resident. We can all use a little reminder sometimes. We also checked on another recommendation that came from a resident about our staff members who are delivering things to make sure that they have on their gloves. It actually is better for us not to wear our gloves because it does contain infections and things of that nature, germs, and it would be better for us to hand them over and have you take responsibility to wash items and to wash your hands. So we're going to look to you to help us out with that. Grocery shopping. Our staff continues to shop daily and deliver to your door. The morning shopping seems to be working out much better for our shoppers as the stores are not as crowded as they put limits to the number of people who can come in the store. As this process gets more complicated, we ask you to consider ordering some of your items from dining. Scott and his team have provided you with a list of items that you can order and can be delivered with your meal. We continue to take the orders for shopping and look forward to bringing some of those groceries right to your door. The next thing I'd like to talk to you about has to do with mail delivery. Unfortunately, the U.S. Mail once again has cut Westminster Canterbury out of their route. Our wonderful staff volunteers are going to the post office starting today. They've already been there, picking up your mail and delivering it to your door in the case of everywhere but the courtyard, and the mail is being placed in your boxes. We will continue to work with the postal system and hopefully get back to normal soon. Newspapers. Our carriers continue to deliver your newspaper to your door. We are so grateful to them. They had no hesitation with continuing with their delivery. This has certainly been a true partnership with the newspaper deliverers. Salon Services continues to offer you hair products from our Main Street salon. We've gotten quite a few calls about this. Please call the salon at 6281 to purchase shampoo, conditioners, and other supplies. The Ellipse doors. This has been one that you've asked us several times, and security has unlocked those doors. So as you go walking on the Ellipse, you'll be able to get back in and not have to go all the way around to the front. From Sherry Grady, I would like to make two announcements. One is about renovations. Renovations have restarted, and they're currently working on apartment 4137. Contractors are being briefed and will adhere to any type of infection precautions. Housekeeping. Housekeeping services are restarting this week. Please be patient as we work through the scheduling challenges. If you have any questions, please contact Sherry at 5110. As I said earlier, I'll be back with you later this week to bring some more answers to your questions. But right now, let's all take a breath and listen to Taryn as she tells us how to de-stress. Thank you.
Good afternoon, y'all. I'm Taryn Young with the Wellness Department, and I am here actually to give you this week's self-care tip. First, I want to thank all of you who have been participating with the videos that we've provided, both the yoga and the cardio stretch and strengthen. I encourage you to keep doing those as often as you want, as long as it feels good. Your self-care tip is to make sure that you're moving at least once an hour throughout your day. It's really important as it helps to build and support our immune system. It keeps us mobile, it helps us with balance, and of course with stress relief. By now you should all have your CV19 cardiovascular 19-day calendar for the calendar challenge, the April challenge. You're welcome to do those movements any time of day. That's a good thing that you can use for your every hour workout. It does not have to be huffy-puffy. It does not have to be heavy lifting. It does not have to be breakneck speed. All you really need to do is reach. Reach with your arms forward or up, out to the sides, whatever feels good. Listen to your body. Reach with your legs. Spread your fingers and your toes. But take the opportunity to move your body and honor it where it is. Feel free to call us if you have any questions about anything that we've already provided or anything that you'd like to see. We look forward to hearing from you, and we can't wait to see you again. Have a great day. Next up is Lynn.
I feel better already. Thank you. This is Lynn Mcclintock, Director of Pastoral Care. When many of you wrote your Lenten Journey submission last fall, you had no idea that we would be on such a journey. A friend of mine said, "This is the lentiest Lent I've ever lented." So we are moving now from Lent into Holy Week, and then Easter, and then beyond. And this progression reminds us that time goes on, that trials do not last forever, and that even in our darkest hour, God is still with us. It's just that we probably this year have been in the lentiest Lent we've ever lented. And while some of us are moving through Lent, others are anticipating Passover, which begins Wednesday and commemorates God's liberation from the Israelites from slavery in Egypt. Both of these seasons, Lent and Passover, remind us that God is with us to bring us through the suffering, to give us an awareness and trust that we are in God's loving hands even when we are wringing our own. For those who follow a spiritual path that is not tied to a particular religion, and even for those of us who do, the rebirth of spring is a reminder that there is a natural force greater than ourselves that keeps the world rejuvenating and evolving. And with the rise of the sun every morning, we are reminded that when we pay attention to the rhythms of the earth, that can give us hope. A resident sent this poem to me, and I'd like to share it with you. Everything is not locked down. Sunrise is not locked down. Love is not locked down. Family time is not locked down. Kindness is not locked down. Creativity is not locked down. Learning, conversation, imagination, reading is not locked down. Relationship is not locked down. Praying is not locked down. Sleeping is not locked down. Work from home is not locked down. And hope is not locked down. Hear these words from Isaiah 35. The wilderness and the solitary place shall be glad for them, and the desert shall rejoice and blossom as the rose. The word of the Lord. Thanks be to God. And now let us pray. Gracious and life-giving God, this year, perhaps more than ever, we can relate to the Israelites' journey through the wilderness and Christ's journey of suffering. As we walk this journey, remind us that we are not alone. Grant us the peace of knowing that we truly do have fellow travelers with us on this road. Reassure us that not only do we walk with others and they walk with us when we can't see them, that you walk with us as well, even when it feels sometimes that we can't find you. Help us to trust that even when we are searching for you, that you have already found us, that you are here, that you love us and will uphold us. Instill deep within us, loving God, the trust that this path we are on is leading us toward the light and new life. Thankful for your mercies and trusting in your promise that you are God with us, we make this prayer. Amen. We hope you have a good rest of the afternoon and evening, and we look forward to seeing you tomorrow at 3 p.m.